Hello, I think it's time for us to get underway. So if we can switch the image over, I'd like to welcome you to today's webinar. I'm Robyn Alders, a consulting fellow with the Chatham House Global Health Program, a partner organisation with the Poultry Hub. This is our 7th panel in our roadmap series. Discussions for the future of poultry, people and planet. These fortnightly discussions address key issues for the sustainable development from the perspective of nutrition security and the global poultry industry. We aim to contribute to the United Nations call for us to build back better from the COVID-19 pandemic. Before getting underway, here's just a few housekeeping notes. Today's discussion will last for 1 hour. The event is being recorded and will be available on the One Health Poultry Hub website. A direct link will be sent to you straight after the registration to all registered attendees. Please put your questions to the panel through the Zoom Q&A function, which you're going to see at the bottom of your screens. Feel free to vote for the questions that you think are particularly important. If English is not your first language, please don't let that stop you from asking questions. As I've said before, I'm Australian and the British tell me that my English is not great, but we still manage to understand each other. I will put as many of your questions as possible to our panelists. And if your question has been covered in a previous answer, or if we run out of time, please accept my apologies. We do have an online discussion channel you can access from the website and from your registration link. Please explore this to share your questions, comments, thoughts. These online discussions will contribute to a series of briefing notes that we'll be preparing on the basis of this series. Today's discussion is on poultry production, vaccination challenges, and the associated scientific and ethical challenges. First, we'd welcome your thoughts on this topic via the first poll, which should be, and I hope is now on your screens. As soon as you vote, the poll is going to disappear from your screen. Okay, I'd like to now invite our panelists for today to turn on their video link so we can see their smiling faces. I'm really delighted to welcome our expert panelists for today. Dr. Michael Francis, the Managing Director of BioVacc Consulting in the UK and a key member of the International Veterinary Vaccinology Network, and Dr. Rebecca Doyle of the Animal Welfare Science Centre, who's a researcher with the University of Melbourne and a collaborating researcher with the International Livestock Research Institute. Each of you has 10 minutes to present your thoughts. We'll give you a signal at 9 minutes and then you'll have 1 minute to wrap up. Mike is going to deliver the first presentation, and I should mention that his internet connection has been a little unstable over the past few days. So if something does go wrong, please don't worry. He's kindly done a pre-record, so we'll switch over to the pre-recorded session if we need to. So thanks very much, and over to you, Mike.
Okay, thank you, Robyn. This is me live. Thank you to the One Health Poultry Hub for the opportunity to give this presentation. As the subject of today's meeting is vaccination, what I'd like to do is just to discuss some of the special considerations when developing a new vaccine for poultry. I'll talk about some of the key points for developing a veterinary vaccine, and I'll talk about the importance of innovation within poultry vaccination. Next slide, please. So what are the special considerations for poultry vaccines? And in particular, I'm thinking about those for chickens. Well, first and foremost, you need to consider the cost of the final product. This is a very price sensitive market and the cost of the vaccine needs to reflect that. Therefore, some of the technologies available to you may not be applicable when developing a vaccine for poultry. The vaccine, of course, should prevent any mortality or morbidity within the birds, but it's important also to look at the productivity of those birds, and that's often what customers require from a vaccine. So you should need to look at egg production or meat increase in terms of FCR when measuring the efficacy of a vaccine. The vaccine needs to be convenient for the customers to administer, so there's a good uptake of the vaccine. And of course, for poultry, generally, you require some method of mass administration. And that can be via on-feed, in water, via hatchery spray, or just simply an in ovo immunization. The vaccine should ideally be a single dose vaccine. It should provide a rapid onset of immunity. And generally, that means immunity developing within 7 to 14 days. And it also should provide a long duration of immunity. And that would hopefully be for the lifetime of a broiler bird. The vaccine also needs to consider strain variations of a particular pathogen, and it should aim to provide as broader protection as possible. And it needs to be stable, particularly when held within a reliable cold chain. And last and not least, it needs to target the particular sector of birds for which it's being developed, be it for broiler birds, for layer birds, or for breeder birds. Next slide, please. So let me just talk a little bit about the vaccine development process itself. This is generally split into two stages, a research stage and a development stage. The research stage can take up to 5 years or more to complete and is split between discovery and feasibility or pre-development. During discovery, you generally investigate the pathogen and the immune response to that pathogen, and you'd come up with an immunogenic formulation that might look suitable as a vaccine. During feasibility and pre-development, you would take that prototype vaccine and run proof of concept studies in target species to show that the vaccine is safe and efficacious, and you develop an outline manufacturing process. Once you have this information in place, you're then ready to go into full development. The development process for a European type vaccine generally takes 3 to 6 years to complete, and it's split between early phase development, late phase development, and registration. During early phase development, you run laboratory safety and efficacy studies to show that the vaccine is fit for purpose. And during later stage development, you would use GMP manufactured material to run field trials to show that the vaccine works under field conditions and is entirely safe. And lastly, you would then take all the data to prepare a dossier that would cover the quality or manufacturing process, the safety, and the efficacy of the final vaccine. And that registration typically can take up to a year or more to complete. Next slide, please. So if you look at this particular website, vaccinedevelopment.org.uk, you will find there some maps of the development process for both human vaccines and for veterinary vaccines. And I published a guide in Vaccine last year to cover the vaccine development process. Next slide, please. So there are some key points to bear in mind when you're developing a new vaccine. Well, first and foremost, you need to develop a product profile. This is sometimes called an SPC, or summary of product characteristics. And this would provide a description of the product and its desired safety and efficacy data. Once you have this product profile in place, you can then develop a project plan to cover the vaccine development process with all the associated timelines. Throughout the product development process, you must keep diligent records of everything you do so that those can be used in the licensing of the product. And it's particularly important to source all materials from safe sources so that they are free from any extraneous agents or TSEs. You should lay down a pre-master seed and a master seed of known and tested quality early on in the process, and you should develop an outline manufacturing process for the vaccine. And you should be using material derived from that master seed and using that outline manufacturing process in any regulatory studies so that they are fit for registration. You need to run studies in the target birds. Often early laboratory studies are run in SPF or specific pathogen-free birds, but you must run studies also in either the broiler, the layer, or breeder birds for which the vaccine is intended. And you also need to run the administration route for which the vaccine is to be registered. And if there's more than one route of administration, then you need to run safety and efficacy studies by each of those routes. It's wise to have a regular interaction with the regulators, and in doing so, you should have an early interaction if possible, and that will greatly facilitate the licensing process going forward. And last but not least, you need to bear in mind the end user, customer or farmer who's going to use the vaccine and make sure it's fit for purpose for their use. Next slide, please. So innovation is particularly important within poultry. You should bear in mind that recombinant technologies have been used in vaccines, although most poultry vaccines licensed today still rely on traditional live attenuated strategies or killed inactivated strategies. Having said this, there are a number of recombinant technologies, and of these, the vector vaccines are particularly important. Viral vector vaccines are now commonly used using a range of different viral vectors. And one good example of this is the TRT vector, which is used to deliver other antigens and recently has been licensed for the delivery of both IBD and ND. So by administering one dose of this particular vaccine, you can get protection against 3 pathogens: Marek's disease, infectious bursal disease, and Newcastle disease. And there are other further viral vectors in development to carry other antigens. Bacterial vectors are also being studied, and these tend to use live, safely attenuated bacterial carrier vectors to deliver other antigens. And there has recently been licensed a vaccine which carries antigens from Clostridium perfringens type A, and that provides dual protection against both Salmonella and necrotic enteritis within the birds. And lastly, there are vaccine vectors nowadays being studied from Apicomplexa, particularly the Eimeria species that cause coccidiosis in birds. So by taking attenuated strains of Eimeria that are used in vaccinations, people have actually used these to carry other Eimeria antigens to broaden the cross-species protection with those Eimeria, and to carry antigens from either viruses, bacteria, or parasites to provide protection against both Eimeria and those additional antigens. Mass delivery, as I said, was very important, and there are a number of innovations used for in-water, in-feed, hatchery spray, and in ovo administration of the vaccines. And there are a range of novel formulations used within the vaccines industry. I've got a picture here of some Spherions, which are freeze-dried vaccines, and temperature stability is something that's particularly important and studied in terms of stabilizing formulations. Next slide, please. So just to summarize, there are a number of important things to consider when developing vaccine for poultry. New vaccine development requires careful preparation, planning, and execution. And poultry vaccines often rely on innovation for improved safety, efficacy, delivery, convenience, stability, and cost. Next slide, please. Thank you for your attention.
Thanks so much, Mike. That was really a very inspiring and challenging talk. You're already generating some questions. There's one question I wanted to ask. I wanted to ask you now before we go on and have Beck's presentation. And my question to you is, what improvements do you envisage in the vector vaccine strategies area in the coming years?
Yes, I think it's a very exciting area, because I think there are lots of things that we can exploit. I mean, there are very effective viral vectors now that provide protection against, as I say, 3 pathogens. But I think it's very exciting now that we're seeing bacterial vectors being licensed, and they have the ability to carry numerous other antigens. And the coccidia vectors are also very exciting, a very cheap and efficient way of delivering a vaccine, and the opportunity to deliver multiple pathogens, giving a single dose, be it by on-feed or in drinking water, to birds to give life protection in broiler birds. So I think there are some exciting developments in the pipeline, Robyn.
Thank you. It is a really exciting area and much to be done. And I think a couple of the questions that will come through will allow you to come back to area as well. Before we go on, could I ask the tech team to just put up the results of the first poll? Some really interesting results here. We can see that 10% of us, so 1 in 10 of us, is not sure about the answer. So we're hoping that by the end of the webinar, that number might decrease. Very interesting to see that the majority of us do believe that we have a problem in that producers are inadequately educated about the importance of vaccination and biosecurity. And in addition, that there's inadequate remuneration of producers, which limits their appropriate investment in vaccination and biosecurity. So thanks very much for sharing your thoughts with us. And now if I could ask Beck to turn on your video, and it's over to you. Thank you.
Thanks, Robyn. So I wanted to answer the second part of this question today, because Mike has obviously done a great job of answering the first part of it, but also animal welfare is my area of expertise. So I'm going to be speaking specifically around the role animal welfare plays in these poultry production challenges around vaccination. Obviously, as we get started, I'm going to be focusing on vaccine for the focus of the talk, but it's really important to state up front that poultry welfare is more than just vaccination, and animal welfare and poultry welfare is more than just animal health. It also includes how we manage animals, how we care for them, the opportunities that they have around behaviour, social interactions, choice and housing and things like that. So when we think about animal welfare from that perspective, it's really, well, animal welfare is very broad, and this is just one specific point that I'm going to be addressing. Another thing that's really important as a caveat before I start is that every production system globally, no matter the scale or the country that it's in, is going to have welfare benefits and welfare issues as well. So when I'm describing, animal welfare today, and in these contexts, each situation is going to be different, and there will be no good situation and no bad situation that I'll be describing. Next, please. Thank you. So obviously poultry welfare is going to be increased with the prevention of disease. That's really, I'm sure we could all agree with that. But when I think about how animal welfare connects to these vaccination challenges, like what Mike mentioned, and through to actually how well it's being provided to animals and how effective it's being to the birds it's being provided to, I think it can be broken down into 3 different issues. The first one is the impact that not having adequate vaccine has on animal welfare. This is highlighted in that second dot point here. Some published work by Butterworth and Weeks, it describes really well the challenges that birds have from a welfare perspective when they're suffering from disease. And that ranges everything from the pain and their behavioural changes through to their productivity and livability. So all different components of I'm sorry, I've just lost my screen share. All the different components of animal welfare that way, and how the individual bird is responding. The second is that there's actually benefits from thinking about animal welfare as a way to control animal health and animal disease. So for example, the conditions we keep animals in and their behavioural opportunities can affect how well animals can cope with disease in the first place and how susceptible they are. So animal welfare can be used as a positive tool in the toolkit along with vaccination to improve poultry health. And then the third welfare connection to vaccines is what happens in positions where there's been disease outbreak. We know that humane culling can be really compromised when there's a large number of birds being culled at scale. Next, please. And then also just touching on what it means for human welfare. So we know the FAO stats from 2019 said that there was almost 26 billion chickens globally. So we know that they play a huge role in animal source food available to all of us globally. From this perspective, having healthy birds in that supply chain or in that food chain has a really strong connection to human welfare. Next, thanks. Great. But then there's also an individual level connection that needs to be addressed. So in low and middle income countries, particularly in low income countries where vaccines might not are not very well distributed, or they don't have the same access to animal healthcare as we would experience in high-income countries. This impact on human welfare from disease and lack of vaccination and animal welfare compromise is really substantial. For example, in this picture, this woman would rely on her household poultry for the essential nutrition that her and her baby on her back, as you can see as well, need as well, and this would also contribute to their livelihoods. The last talk in the poultry series, in the One Health Poultry series, covered the role of gender in poultry production, and that would be a really nice starting point for anyone that wanted to learn some more about this. Next, thanks. So when it comes to vaccines and welfare barriers, where the challenges are, aside from all of the challenges around implementation and creation of vaccines that Mike mentioned, there's other components that are specific, I think, to some of them that are specific to poultry and some of them that are specific to different resources that influence how well animals can cope, or poultry can cope in this situation. So, for example, poultry are small animals with short lifespans. So when they're thought about in terms of their animal welfare, they're often thought about as a group, even in small settings. This means that the welfare of individual animals is overlooked often, and that obviously from the welfare of that individual bird is really significant. So there's that component to it too. When we're thinking about something that has, a 5 or 10% mortality, but you think about that in the context of how many birds are within a household or how many birds are globally, then that's a huge number of individual animals that are experiencing a welfare challenge. In some positions, particularly in low-income countries, health support services, animal health services are poorly supported. Human health services are poorly supported in lots of cases as well. And so the opportunity to actually vaccinate and have that have those wins there for animal health and productivity don't exist so much. And then the third point I think is really important too, that often it's kind of presumed that farmers don't know enough about animal health or don't seem to care so much about providing the adequate healthcare for their animals. And this really misses the complexities and deficiencies around the system, like I described before. One of the key things that we see coming up time and time again with different species is that when farmers have invested previously in the health and welfare of their animals, and it hasn't resulted for whatever reason in the outcome that they had expected, they're obviously less likely to invest in that going forwards. And that has impact, and that impacts obviously how much they're willing to invest in terms of their time and their emotion and their finances. And obviously it reflects the previous investment that they've had as well. So I think that's an important component of this, that sort of social or psychological impact. Next, please. And then looking at welfare opportunities for production opportunities going forwards. Like I mentioned right at the start, vaccines are an important component of a broader control strategy, and this goes hand in hand with animal welfare. So, for example, biosecurity, hygiene and management are all critical in that, but also how those animals are cared for in terms of their husbandry, the housing opportunities that they have, from the densities that they're kept in, the shelters that they have available to them. All of these different components and are going to be influential to that animal's welfare, and then also influential into how robust it is against disease and other health issues. There's also, in terms of in low-income country settings in particular, and in intensive production poultry, the role of different breeds as well. So, for example, in situations where vaccines aren't freely available or as effective as they should be, local breeds are going to be more resilient to diseases in that context. And at the same time as well, there's going to be different breeds that are going to be better adapted to more commercial poultry production where that's available to them too. And then finally, good stock management as an early identification and intervention for disease is critical. And that obviously affects other welfare challenges too. What we can see is that equally resourced farms that might have the same breed, environmental conditions, feed availability, and healthcare availability will still have differences in welfare. And that comes down to how well the person or the people are managing those animals and caring for those animals. So being able to have, good stockmanship or stock personship is really critical for that as well. Next, thanks. Thank you. And then, yeah, just finally, I thought that this was a really nice quote from Butterworth and Weeks as well, where they described, the role of animal welfare at the flock level and down to the individual level. So while flock health is frequently chosen as an index of welfare, you shouldn't be losing sight of that individual animal, because not only does that individual animal have a capacity for suffering, but for some people, individual animals like this woman in this Indonesian wet market, those individual animals are critical to her livelihood as well, and the household food security and her household food security too. So thank you very much.
Thanks so much, Beck. That was a really lovely balance to go alongside Mike's vaccinology and very technical talk. You've brought the human side as well as the animal welfare side. So thanks very much. It is a really complex issue. We've got some great questions coming in. Do please keep them coming in. One question to you has come through with a similar theme from two people. Dr. Narun and Bimpe are asking, is it right for animal welfare to be considered in low income settings?
Thanks, Robyn, and thanks to the two participants for that question. Yeah, that is a great question because and I think it's a complex one to answer, but essentially we can see through there's different pieces of evidence that show that animal welfare is right and important to consider in low income settings. The first one is how people respond to animal welfare. So, farmers that we work with in Ethiopia with different production species, not just chickens, will describe having a really close connection and reliance on their animals as much as they know that their animals rely on them. So they talk really very much about welfare and care being a two-way system between their animals and themselves, which demonstrates that animal welfare is important to them. We can also see at a policy level that animal welfare is important. So, for example, the African Union has been working on its animal welfare strategy, and almost all continents, well, habitable continents, obviously Antarctica doesn't count, but habitable continents have animal welfare strategies as well. So that's two different levels of where animal welfare is coming into play. And then hopefully, like I spoke about in my presentation, animal welfare as a component is tied to animal health. And so actually by having good welfare, we're going to have better health outcomes for those animals and therefore better productivity for people, which is a saving in resources and also good for people's livelihoods.
Thanks, Beck. That was a great answer. We're having a lovely tussle here in the voting, so I'm going to go with the one that's on top of the voting right now. I think this might be a question for you, Mike. Dr. Udin is asking, how can we decrease the reliance on cold chains for vaccine distribution?
Yeah, thank you. That's a very important point, because you can make an excellent vaccine, but if it's not stored and delivered correctly, then it's pretty ineffective. I think there are a lot of opportunities now to stabilize vaccines. Particularly exciting is we've seen thermostable strains of Newcastle disease virus, for example, and those have actually been engineered to vector infectious bronchitis antigens, and that's really quite interesting. I'd also like to share some work that I've been doing recently in collaboration with Oxford and Pirbright on a vector vaccine, not for poultry, but for Rift Valley fever in livestock. And here we were using the ChAdOx1 vector, which is one of the lead candidates for COVID-19. So this will be of interest to people. And what we found is that that particular vector was a fairly stable vector. It could be stored for a week at 30 degrees and a month at 20 degrees. But we then took it and further stabilized it by freeze drying it with particular stabilizers included. And we could store that for at least 6 months at 30 degrees centigrade. So I think those sort of technologies will find their way through into poultry vaccines and will provide better opportunities to deliver safe vaccines in the field.
Thank you. That's really encouraging. Now, I do see that Professor Nitish has a very strong voting here. but I'm not going to ask his question next. I'm actually going to go to a question from Andy Catley because it relates to the opening poll. And I think he does present an issue that I'd like to hear from both of you, your response to his point. Andy says that I think the poll provides a very limited framing of the challenges facing vaccination. The fundamental challenges are at the policy and institutional levels. Technical and educational approaches have a role, but will have limited impact unless the policy and institutional environment enables better delivery of veterinary vaccines with appropriate roles assigned to public and private sectors. Mike, Beck, which one of you would like to answer first?
I'll have a go first. I mean, personally, I think everybody needs to be engaged when it comes to vaccination. And I think the policymakers in particular in certain countries do need to get engaged in terms of what is required to control the disease and to interact with the end users and with the pharmaceutical companies who are supplying the vaccine to facilitate the process, because quite often there are good, effective ways of preventing these diseases, but they're not reaching the marketplace because the policies don't necessarily allow it, or there aren't the regulatory systems in place to allow it. And I think that's something that we need to work on in the future to facilitate the process going forward.
Thanks, Mike. What do you think about that, Beck?
Yeah, thank you, Robyn, and thanks, Andy, for the question. Yeah, I really agree that policy has a critical role in this, and I think it kind of goes back to one of the points I was making of how farmers often, always sort of or animal owners are always the people that kind of get laid blame when things aren't being implemented well, because it's their responsibility. But I think that actually really so much of that sits around education and policy framework around that, understanding why farmers don't have the opportunity to invest, or why they don't think it's important to be vaccinating their animals, is the important first step to actually understanding then what policy changes need to be made, because it comes down to being able to provide that support to them and the information to them, and reliable resourcing around animal health that's going to encourage them to keep investing it in the future. And then obviously as well, hand in hand, that then means that they have more money to invest in future in animal health, because they actually then are having more healthy animals going to market or fetching a better price or whatever it might be. So yeah, I think that actually that policy space is critical if we're going to be making any broad challenges or broad improvements to how animal health and vaccines are being delivered.
Thanks so much, Beck. And it really is the policy element that we're extremely interested in. So while this is a short webinar, we would love this policy discussion to continue on our Slack channel. So all of you with thoughts and ideas around in this space, do please add them to the Slack channel. It can be today, it can be tomorrow, whenever you have time, but do please share your ideas. And now with 10 votes, I really do have to ask Prof. Nitish's question. And I think it might be one for you, Mike. Prof. Nitish is asking, what strategy would you suggest for zoonotic pathogens like high pathogenic avian influenza? They do not fit what you suggested in your slide.
Yes, I mean, it's an interesting question. I think they do fit the innovation parts of my slide. I mean, I agree that using traditional approaches against some of these high pathogenic strains of influenza and new emerging strains can be difficult. But I think some of the vector strategies could be very applicable here. I mean, vector antigens have been used for influenza in birds, and I think they would be an ideal system for delivering emerging pathogens and high pathogen influenza strains to birds. So I think there is a platform ready to go. And as we're seeing with COVID-19, a lot of these new vaccines platforms are being tested for the first time in people, and we're seeing the value of some of these platform technologies. I mean, the other one possibility is nucleic acid delivery, as we've seen with mRNA and DNA. My only concern there is it is a fairly costly technology for poultry use, but the vector platforms I think are very appropriate, viral vectors, I should say.
Thanks, Mike. And I might just, while we're talking avian influenza, I might just jump to a question from Prof. Hoa in Vietnam, where she says producing new vaccine takes time, while the genetic evolution of a pathogen, such as the avian influenza virus, is fast. How do you deal with this issue?
I mean, it's a different answer as to what I would have given perhaps a couple of years back, because we now all see that vaccines can be developed in speed, a quick time, if the desire is there, as with COVID-19, where in record time, in under a year, we've got vaccines from scratch to the marketplace. And of course, influenza vaccines themselves are updated for humans on an annual basis, with new strains being incorporated within the vaccines. I think there are now technologies, again, like vector technologies, where you can plug in a new antigen, do certain safety and efficacy studies, and get a product licensed in fairly short time. And if that platform itself is already recognized by the regulators, I think the process can be speeded up. And I know in Europe, the regulators are looking at trying to help licensing platform technologies so that when they are needed for new emerging diseases, they can be more quickly developed.
Thanks, Mike. It's good news. And in this world of where we seem to have an increasing numbers of virus that seem to be spreading and evolving, that is good news indeed. Beck, we have a question for you here from Lydia, who's asking, what role can institutions and policy play on animal welfare?
That's great. Thanks, Robyn, and thanks, Lydia, for that question. So I think, again, like I mentioned with the veterinary services before, I think that policy plays an incredibly important role in animal welfare. When we think about animal welfare, you know, there's a sliding scale, obviously, from what are acceptable minimum standards through what is sort of gold standards, best practice, or evolving improvement in terms of animal welfare. Often we see in that those evolving standards and that sort of forward progress in animal welfare is coming from market-driven sources. So, for example, Christine Nichols' talk a couple of events ago in this poultry series was talking about that from the UK perspective, and how people in the UK, consumers, are changing poultry welfare based on their purchasing power. But then from a policy side of things, we also need sort of, you know, so I guess that the market is sort of the carrot approach, whereas we also need a sort of stick approach to raise that minimum standard. And I think that's essentially where most important policy can come into play. We're making sure that there's standards and guidelines and enforceable standards and guidelines in place for minimum standards on poultry welfare or animal welfare in general, and that these are agreed to and developed in collaboration with all of the important stakeholders, and to make sure that they're, you know, legitimate and appropriate and able to be put into place. So I think that's sort of the first step, and that's really where that kind of raising the bar in animal welfare is going to be happening. So I think it plays a really important role from that perspective.
Thanks, Beck. And it also must be encouraging for you to see that animal welfare is being raised in a number of webinars and is part of the discussion leading up to the United Nations Food Systems Summit. So I think this is really an opportune time for the various perspectives on animal welfare to be heard and to have that debate in a public space. Mike, we have a really important question here for you from Dr. Halu. He's asking, what are the major challenges for vaccine development in developing countries, and how can those challenges be addressed with international research collaborations?
Yeah, I think that's particularly important, because I think I've mentioned a lot of exciting technologies, but sometimes they don't find their way through into the important markets in lower middle income settings. And I would say that there are lots of opportunities really for developing improved vaccines and improved delivery systems and more convenient vaccines for those marketplaces. I'd like to put in an advert here perhaps for the International Veterinary Vaccinology Network, which I'm a board member of, because we are trying to reach out to people across the globe to facilitate interactions and discussions between policymakers, scientists, and producers, so that we can bring technologies to those markets and help people within those markets to develop those vaccines that they need. and to facilitate collaborations between people from those markets and other people who have those technologies to deliver. So I think there are opportunities going forward. I think we need to work harder to make sure these collaborations actually happen. But it's very important that we do try and provide some of the benefits that we can do in terms of improved technologies to these markets.
Thanks, Mike. That's very encouraging. And at the end of this webinar, we're going to put up a plug also for the International Veterinary Vaccinology Network that's having a symposium that's co-hosted by our hub. So the details of that meeting will be shared with you all at the end of this webinar. I see that there's a question here to Beck from Mohammed Rashidul Alam. Apologies for my terrible pronunciation. Mohammed is asking, what are the key necessary welfare issues that should be addressed in vaccination?
Thanks, Robyn. And thanks to Rashed for that question. He's a colleague of mine in Bangladesh. So it's lovely to have you here, Rashed. So yeah, that's a great question. I think one of the really important things to consider, Mike touched on this in his presentation, which is why I didn't mention it in mine, is the lifespan of that animal and the role of that animal when it comes to providing vaccines. So, for example, even when you have dual purpose breeds and different animals will have different lifespans. So if it's a breeder animal, it's going to have a longer lifespan. If it's an egg-laying animal, it's going to have an egg-laying bird, it's going to have a longer lifespan compared to something that's a meat chicken. And so making sure that that vaccination schedule and all the other health support that goes behind that is being tailored to the duration of that animal's life, and thinking about what that animal is going to need across the length of its life is going to be really important. So I think that that's the first one. And then, yeah, I mean, obviously from a welfare perspective, there's making sure that vaccination is being given in a way that's effective and is going to generate that response that is needed in the first place. But then also making sure that the health support system, from identification of disease through to its management, is present as well, to make sure that if animals are susceptible with or without vaccine, to make sure that they're receiving the adequate care that they need.
Thanks, Beck. I'm just going through, there's lots of lovely questions here, but a very important one is coming in from Rabia saying how to access the Slack channel. So I'm going to put a call out to my lovely IT colleagues. If you could please share the Slack link in the chat so our colleagues can see it, that would be great. We would love to have you involved there. So Mike, lots of questions for you, but I'm going to ask the one that has the top vote for the moment, and it's very topical. I'm sure a lot of people are asking this question. What are the timeframe differences between human and veterinary vaccine development, particularly in the light of what we're seeing happen with the COVID-19 vaccines? Mike.
Yeah, thank you, Robyn. Yeah, very interesting question, because I mean, the timeframes have changed significantly as a result of COVID-19, and normal frame to develop a human vaccine would be significantly longer than a veterinary vaccine. So again, I say to have done it within a year is truly remarkable. Coronavirus is a particular disease for which we knew vaccines could be developed in the veterinary field, and so the technology existed in some ways and we knew the approach, and so we shouldn't expect that for all new emerging pathogens. Unfortunately, I think the public's expectation has been raised by the efficacy of the COVID vaccines. But the veterinary vaccines, it's interesting, the time frame there is generally shorter than human vaccines, because what we can do with veterinary vaccines is we can go into the target species at an early stage and show the vaccines are safe and efficacious under controlled conditions, which you clearly can't easily do with a human vaccine. So generally, once we've done that early feasibility pre-development work to show that we have a prototype vaccine formulation, there's generally a high chance of it getting registered through the regulatory process because we know it's safe and efficacious. For human vaccines, there's a lot more risk involved, and very few products actually make it all the way through phase 1, 2, and 3 trials into the marketplace. So the veterinary process is generally more rapid and more predictable.
Thanks, Mike. I think I'm encouraged by that. Thank you. Beck, there's a question here from Ben David. He's asking what percentage of farmers or animals are vaccinated in different parts of the world? And are manufacturers producing the product for not so commercial farmers? What are your thoughts on that?
That's a great question on Ben. So yes, I think that's a difficult one. I guess I would say that in a lot of low-income settings, and specifically, I'm not talking about poultry necessarily, but different production species in low-income settings, access to vaccines and health support in general is often provided by the government, and that focus is really largely on vaccination programs. And then, from my experience, it's not always well supported and well coordinated, I guess. But in lots of places, it is free for farmers. So I think that there's some really strong positives there, but also lots of room for improvement. Often when it comes to farmers seeking health support or veterinary health support for their animals, the barrier is cost and availability of resources. So there's lots of room for improvement, I guess, is all I'm going to say, is what I'm going to say to that. And I guess to kind of connect it back to some of the discussion we've had around COVID and how that's changed the vaccine space. What we saw in some of our smallholder farmers in Pakistan, for example, during COVID, was that their opportunity to access veterinary care during that time was really compromised as well, further more than what the challenges they currently experience already in normal times. So I think that when it comes to looking at ways to improve that and make sure that these vaccines and health support for animals is available, it needs to be available better than it is at a standard time, and then also having some procedures in place for when support services drop off, like we saw in COVID.
Thanks, Beck. Mike, did you want to add anything to that question?
Well, no, I think Beck covered a lot of the areas I would have done. I think just to stress again, cost, that was one of the first points in my slide. It's a very price sensitive market, and you can have an excellent vaccine that would never be used in a bird because of its cost. So we're talking about vaccines that need to be perhaps a few cents or fractions of a cent per dose, sometimes using sophisticated technologies. And the other side is convenience in delivery. I think they need to be convenient to deliver and easy to deliver. And I think it's easy with more intensive systems to show the benefits of a vaccine in terms of improvements in productivity. And that's really, at the end of the day, what farmers require. They want to show that the vaccines reverse any losses in productivity. And that's not so easy in smaller holdings where there are fewer birds. But I don't think it does require, the government to become involved, and for perhaps better education of people in terms of the value of vaccination, in terms of preventing disease and preventing spread of disease from flock to flock as well, because I think they really are the answer to in controlling these diseases environmentally.
Certainly, I would agree. I won't go into detail. Many of you know I've had a long history of vaccinating or helping farmers to be able to vaccinate their village chickens. And sometimes it is an issue of cost sharing. If you're talking about extremely poor people, maybe they're paying part of the cost, but they're not paying all of the cost, because the flow-on benefits from having improvement in the welfare of their animal and in the well-being of their household is of benefit to the government and to have private sector partners involved there. Now, there's one question that's been sitting at the top here for a little while. I have to ask it to you, Mike. Dr. Haidaruliman, once again, I haven't pronounced that correctly, I'm sorry, but the doctor is asking, the in ovo vaccine has been tried for viral, bacterial, mycoplasma, and protozoan vaccines. What could be the probable reason that it is not being so popular?
I think it's growing in popularity. I think it's still an emerging technology. I think it's being more widely used these days, particularly by large producers, and it's being shown to be a very effective means and convenient means of administering vaccines. So I think we will see it more widely rolled out in the future. Of course, there is a technology side of this where you need a degree of know-how and equipment to actually deliver the vaccine, and being able to just inject birds or put it on feed or put it in the drinking water is sometimes more convenient for people who don't have the expertise and know-how to deliver it in ovo. But I think we will see it growing in the future, and it's certainly one of the indications that manufacturers are very well aware of and generally want to put on their labels for their new vaccines they're developing.
Thanks, Mike. We have lots of excellent questions here. We're not going to get to all of them. I'm very sorry, but your questions will not be lost. Any that we don't answer here, we will be able to respond to on the Slack channel. There's one question. I think I'll start with you, Beck, if you'd like to respond to a question from Peter Stevenson, who asks, are there any examples of backyard or smallholder poultry keepers in low and middle income countries buying and regularly using vaccines without the support of donors or projects?
That actually is probably a good question for you to answer, Robyn, because that, is your area of expertise and, years of work. From my side, briefly, what I would say is that, purchasing mixed genetic breeds tend to mean that those animals sometimes come with vaccinations provided. But really, farmers want to be in low-income settings. To my knowledge, farmers want to be able to breed their own animals and have their own flock that's sort of self-sustaining. So from that perspective, birds that come in vaccinated don't stay vaccinated, and I don't know really to the degree of what health support services are there. Obviously, it's region and country basis. So it's a hard one for me to answer. I'm sorry.
No problem. I did post a couple of papers on the Slack channel. So for those of you who would like a little bit more information on that topic, there's some opportunity there for you for some light reading. This question I'm going to ask both of you. It's from Sayaka, and it's, do farmers have enough financial incentive to administer vaccines? If not, how can the process be encouraged? I'm not sure which one of you would like to answer first.
I mean, in terms of financial incentive, I guess it's how they value their business. I mean, I think you have to demonstrate the value of vaccines in terms of preventing losses caused by disease pathogens. Quite often we're very ready to treat animals and birds if they become infected and try and cure them, but perhaps we don't always see the benefits of using vaccines as a prophylactic measure of preventing disease. But I think if you can do the analysis, particularly in, say, layer birds or broiler birds, and show the benefits in terms of losses in production, losses in productivities, and preventing those by vaccinating the birds and preventing the diseases, preventing morbidity and mortality within the birds, it really should become an easy answer from the end user that they do want to vaccinate their birds, because it's an insurance policy above anything else in terms of preventing those diseases coming into their flocks.
Absolutely. Beck, did you want to add to that?
Yeah, just really briefly, I think, Sayaka, that really comes down to the type of production system as well that we're talking about. In commercial poultry production, you have vertical integration and you also have economy of scale. So you're more likely to get investment from that side of things because doing things on bulk or en masse is going to be cheaper. Whereas in smaller settings, whether that's in high income or low income settings, that's going to be more of a barrier. So I think that the type of production system needs to be considered when we think about that. And I guess that's sort of one of the points that I was making before, is that every production system is going to have welfare benefits and welfare challenges, and access to health from a financial perspective is going to be something that's a barrier for small scale producers.
Thanks, Beck. This has been really a fascinating discussion, and as I say, we've got some excellent questions that we haven't yet got to. We will get to them on the Slack channel, but we are approaching the end of our live 60-minute session. I'd like you to join with me in thanking our two expert panelists who have highlighted several crucial points, including Mike's recommendations that multiple important, if I can ask the tech team to put up our key messages. Mike made points that multiple important points must be considered when developing a new vaccine for poultry. And that development requires careful preparation, planning, and execution. And clearly, innovation needs to focus on improved safety, efficacy, delivery, and convenience, stability, and cost. And Beck highlighted that vaccines are essential for good animal welfare, and that animal welfare needs to be considered in all production systems and situations and all along an animal's life. She also highlighted that considering animal welfare is important to the birds, their owners, the community, and the environment. For you in our audience, we'd like your perspectives following today's discussion. So do please share your feedback via our second poll, which is hopefully coming up onto your screens shortly. Once you've voted, that should disappear from your screen. Thanks again to our wonderful panelists, Michael Francis and Rebecca Doyle, to our tech team working in the background to make everything run smoothly, and to you, our audience, for your interest and your questions. As I mentioned, do please continue the discussion on our Slack channel. It's a really important topic, and we do need to have diverse opinions and ideas coming from your various situations. Hopefully you've got that Slack link now. So if we can see yes, here we are. So our roadmap series is continuing, and on the 17th, we're going to have an excellent discussion. It's going to be moderated by Professor Dirk Pfeiffer, and he's going to have Professor Stephen Hinchcliffe and Professor Gabriel Leung, and they're going to be looking at the role of modelling in COVID-19 and why modelling cannot answer all of our questions. I'd really encourage you to sign up for that webinar. And also, if we can go on to the next slide, as I mentioned, the International Veterinary Vaccinology Network, together with the Poultry Hub, is co-hosting a symposium on vaccines for poultry. And that's on the 25th of February. There's a link there where you'll be able to register for that presentation. If we could now see the results of our second poll, we'll see, even though it's not quite the poll Andy would have liked to have seen, what we can see is that we still have some people who still don't have, who are not sure about the answer to the question. And interestingly, the numbers haven't changed that much in this discussion, so in this poll. So I really do encourage all of you to continue the discussion on Slack, because it is really very important. Vaccination, as one of the questions mentioned that we didn't have time to get to, in terms of antimicrobial resistance, having birds that are vaccinated and well vaccinated is quite crucial to this other challenge as well. So thanks very much for your time, for your input. We wish you all the very best. Please stay safe, and thanks for joining us. Bye-bye.
Thank you, Robyn.